Hello everyone, thank you for joining me today. In this presentation, I'll explore the critical role of cybersecurity in the healthcare industry, especially in the digital era where data breaches and cyber attacks are becoming increasingly common and severe. As healthcare systems undergo rapid digital transformation, adopting telehealth platforms and electronic medical records, they become more vulnerable to sophisticated cyber threats. These threats don't just cause financial damage, they endanger lives and compromise public trust in healthcare. My research zooms in on how artificial intelligence can address these vulnerabilities more effectively than traditional cybersecurity models. Unlike static rules and manual responses, AI adapts in real time, learns from threats, and can scale to protect entire healthcare networks. I also looked into the darker possibilities like bio-terrorism and medical warfare, where AI could be pivotal in both defending and worryingly attacking. This adds urgency to the need for ethical oversight. Finally, the study also probes deeply into the ethical dimensions of AI in cybersecurity, such as algorithmic bias, transparency, and compliance with legal frameworks like HIPAA and GDPR. My goal is to find a balance between innovation and patient. The digitization of healthcare has transformed how we deliver medical services, especially post-COVID. Telehealth and cloud-based records are beneficial, but also increase cybersecurity risks. Emerging AI technologies offer solutions like predictive analytics to identify threats early. However, ethical concerns regarding transparency and fairness necessitate the development of explainable AI models. My literature review draws from an extensive set of academic and professional sources, including IEEE Explore, PubMed, and leading cybersecurity publications. Post-COVID, the digitization of healthcare has skyrocketed. Telehealth consultations, remote patient monitoring, and cloud-based electronic health records have opened new doors, but also new attack surfaces. Research highlights that traditional cybersecurity frameworks are failing to keep pace with this shift. Static firewalls and signature-based detection systems can't respond to today's fast-evolving AI-enabled attacks. Emerging literature points to AI as a vital tool. Predictive analytics and anomaly detection algorithms can identify threats before they escalate, something traditional systems struggle with. One major focus is federated learning, which allows AI systems to train across multiple institutions without sharing raw data, thus enhancing privacy. Ethics is another key theme. As AI makes more decisions autonomously, there are growing concerns about transparency and fairness. This is why there's a strong push toward explainable AI, XAI, and periodic bias audits. The consensus is clear. Healthcare needs adaptive, ethically sound AI models that comply with strict regulations like HIPAA and GDPR. For this study, I used a qualitative research method based on triangulation, collecting data from literature reviews, case studies, and expert interviews. This approach provided a well-rounded analysis of AI's impact in healthcare cybersecurity, highlighting real-world outcomes, integration challenges, and ethical concerns regarding patient confidentiality. For this study, I used a qualitative research methodology grounded in triangulation. That means I pulled data from three main sources to ensure an ill-rounded analysis. First, I conducted an in-depth literature review, analyzing academic research from IEEE, PubMed, and industry white papers. Second, I examined real-world case studies, focusing on healthcare providers like Mayo Clinic and Cleveland Clinic, who are leading the way in AI integration. Third, I included expert interviews, gathering insights from AI developers, hospital CIOs, and cybersecurity professionals. For data collection, I relied on scholarly publications, internal reports from healthcare institutions, and expert commentary. I focused on collecting data that reflects the real-world outcomes of AI-driven systems in hospitals, the specific challenges in integrating AI without violating compliance rules, and insights on how to balance technological innovation with the ethical responsibility to safeguard patient confidentiality. This multi-pronged approach helped us create a comprehensive view of both the potential and the limitations of AI in healthcare cybersecurity. The discussion section brings the research findings into sharper focus. I discovered that static, rule-based cybersecurity systems are no longer viable in today's environment. Cyber attacks are not just more frequent, they are more sophisticated. Healthcare systems are increasingly facing threats such as identity theft of patients, financial fraud through billing manipulation, ransomware attacks that can freeze entire hospital operations. These breaches don't just cause reputational damage, they can disrupt surgeries, delay diagnoses, and even lead to loss of life. For example, a single breach at a major hospital can compromise hundreds of thousands of patient records. On the flip side, institutions like the Mayo Clinic have successfully implemented AI-driven predictive analytics, which help them detect health risks early and reduce patient mortality. Cleveland Clinic has deployed AI-based cybersecurity systems that detect threats before any damage occurs, strengthening their data protection. The bottom line, AI is not just a technical upgrade, it is a strategic necessity for modern healthcare systems. AI-powered security model, features, benefits, and implementation. My proposed AI-powered security model brings together several advanced technologies to create a comprehensive solution. At its core, the model uses predictive analytics and real-time monitoring to detect anomalies and threats before they escalate into full-blown attacks. It incorporates federated learning, which allows AI models to be trained across multiple hospitals without compromising sensitive patient data. To ensure fairness, I've integrated bias mitigation algorithms and explainable AI, XAI. These features make it easier for hospital administrators and regulators to understand how decisions are made, which enhances trust and accountability. The model is built to be fully compliant with global regulations like HIPAA in the US and GDPR in the EU. Built-in encryption, audit trails, and ethical oversight ensure legal and ethical adherence. The benefits are clear: reduced incident response time by up to 70%. Improved patient trust, secure global collaboration, including telehealth and remote care. Implementation involves a robust deployment strategy, complete with infrastructure scaling, Internet of Things, IoT security, model updates, and staff training. One real-world application is a HIPAA-compliant mobile app that securely manages healthcare data using encryption and AI-driven compliance checks. This not only enhances security, but also empowers remote care and telehealth delivery. To wrap up, this research shows that AI has a transformative role in healthcare cybersecurity. It enables systems that are not just reactive, but proactive and adaptive, learning from threats and evolving alongside them. AI helps reduce risk, supports legal compliance, and ultimately strengthens the digital infrastructure of healthcare systems. By integrating technologies like predictive analytics, federated learning, and explainable AI, I can protect sensitive healthcare data while still driving innovation and global collaboration. These models offer a pathway to ethical, scalable, and regulatory compliant cybersecurity. In an age where healthcare is increasingly digital, patient trust is more fragile and more critical than ever. AI can help us protect it.